I know there are several Pachanas with Deepana and Pachana herbs, but is Amrutottara Kwatam really that powerful for anybody to release Ama?
It's for better thing is that it is Trikatu Churna. That's a basic drug formulation of Ayurveda. It's a very well drug a combination which can do Amapachana. Then other drugs which we usually use is Chitrakadi Vati. Amrutottara Kashayam is of not that much, but of course contents of Amrutottara Kashaya also capable of handling the Amapachana. For the intention, if it is for the Amapachana, then we have better drugs, a better drug at our disposal. That is Trikatu Churna and Chitrakadivati.
Okay, but even in the excess ama condition with respect to arthritis or other kind of really heavy ama.
If it is arthritis condition and if ama is there, then the better drug is Shunti. Shunti is the better drug which can be used for these conditions.
Okay.
Shunti Amapachanam, it is said.
Okay. Okay. Thank you so much.
So this Amrutotharam contains only three ingredients: haritaki, guduchi, and ginger. If ama is the prime target, then Trikatu or Chitrakadivati would be the better choices. Dr. Vijayalakshmi has written, well said, Professor Kurraja sir, we can blindly go by the test reports when the patient is being consulted by an Ayurvedic doctor. Many times I have seen even the lab reports are not correct. Our body speaks the truth. And even in the lab report at the end of the say that correlate with the clinical observations. Lab reports are useful, but they are not be all and end all of clinical practice.
So definitely, it is not a. I said that's what it is a secondary supporting factor for our establishment. When we have established the doshic imbalance, we understood the pathology samprapti, then we are utilizing our drugs and we are giving the results. To prove that result in a scientific world, we need to understand to take help of these things because world speaks in this language. So either we make them to speak in our language or we may have to understand our thing in their language. That's what the criteria is. So to do that, we need to take up the help of these lab investigations. And if they are fall in line with our things to prove, then it is very good. No harm in it.
But like she said, if it is Amavata and rheumatoid arthritis, still, I mean, may not be for Deepana Pachana, not only for that, but as a whole, because Amrutottara contains Guduchi, Haritaki. I remember, Virechana is there told as one of the ways to treat. I think there's in Amavata, Vaishya Ratnavali, there is a reference of castor oil with Haritaki. So Haritaki has its use in Amavata. So ginger also does some amount of Deepana Pachana. So it's not a bad choice there, sir.
No, it is not a bad choice, but you need to understand that always we have to select the best drug or best yoga for any condition. So if your intention is to break the ama or Amapachana is your intention, then Trikatu is the best combination.
Another question has come. Respected sir, if there are two diseases in a patient, say rheumatoid arthritis and varicose vein, which should be treated first?
No, there is no hard and fast rule that which should be treated first and which should not be treated at the last. The thing is that if you could be able to address both of them simultaneously, it will be better. So in this condition, what my choice of drug would be, if it is a rheumatoid arthritis and with associated with varicosity, then my choice would be something which is sour in nature, amla rasa yukta dravya combination with Gugulatitta Kashaya. Gugulatitta Kashaya will do the things, and along with that, if some sour material is there, that is Amla Rasa, because Amla Rasa Hrudyanam, Amla Rasa is able to clean the tracks, that will be good. Srota Sodaka, it is in nature. So we'll use that combination for that. And there is no hard and fast rule that we should treat only varicose vein first or later only we should go for the Amavata. It is not like that. And both rheumatoid arthritis and varicose veins is a chronic conditions. So all these chronic conditions require a long therapy time. So we don't want to waste our time in treating only one condition, allowing the other conditions to enhance. Many a times that throbbing pain because of the varicosity will also enhance us, and you will be in a dilemma whether that pain of being set by the patient is whether it is due to varicosity or whether it is due to Amavata. It will be in a dilemma. So better you take choice of such a drug or a combination which can handle or target both these issues. So we can, in this condition, Gugulatitta Kashaya is the best option.
So in the sour tasting medicine option, Dadi Mavaleha can be good or any other.
Instead of avaleha, it is something like a liquid or a syrupy base or something kashaya which containing that, or even straight away, there is one brand in the market, like I don't know, Cardorium Plus, something like that. Or even I asked my patient to see an entire day, if you are able to drink 2 to 3 liters of water, just in that 2 to 3 liters of water, and keep it in a separate vessel, put one half of the lemon juice into that, and it becomes so diluted, but lemon added flavor you will get it, and use that particular water throughout the day for your all purpose of drinking. So then, and don't use it for the next day. You should be completed within one day itself. So that type of water mixed with some sour materials like lemon or something like that, that also in a long run makes the alkalinity of the body and the cleansing of the things, and srotasis will be opened up.
And next is, can too much body heat cause cold and flu symptoms? How to approach this?
It is what we called something like Ushna Shita combinations in a common flu type of thing. So nothing to worry. It is a combination which has evolved due to the participation of both kapha as well as pitta in the manifestation. That's it. That's why the shitata of kapha, ushnata of pitta, both are prominently producing their symptoms and quite contrasting, but still they are existing and showing their effects. So we need to understand here, we need to suppress by giving something which is causing a more problem. Like if kapha is obstructing the path in a large way, then we need to go for reducing the kapha first. And if it is too much of burning sensation or heat, then we need to go for the cooling aspect. Whichever is dominantly presenting, that has to be tackled first to give the basic support line relief to the patient.
I think in Sama Pitta condition also there will be kind of Ama and Pitta together, so there will be hot and cold symptoms getting mixed up.